now joined by former federal health minister Dr. Jane Philpott, who is now Dean for Health Sciences at Queen's University, also co-author of a report released last week from the Public Policy Forum. It's called Taking Back Healthcare. Dr. Philpott, nice to see you. Thank you for being here.
My pleasure. Thanks for having me.
So a lot to talk about here, but I do want to begin with the concern being expressed by Mr. Singh. Do you have concerns about provinces using public dollars to fund private healthcare delivery?
Well, in fact, this is one of the matters that is addressed in our report, the Public Policy Forum report, where we speak about the fact that in many ways this becomes a bit of a red herring, this conversation around private delivery of care. The reality is that an enormous amount of care is already delivered privately. For example, most family doctors across the country are private practitioners and run their own private corporations, but they are publicly funded. And so it's important to make sure that when we're talking about private care, the concern comes in private pay. We don't want to see people being able to jump the queue by paying separately outside of health insurance for medically necessary care. So unfortunately, it becomes a bit of a distraction. And as part of the conversation, Mr. Singh is correct that, of course, one of the challenges is the health workforce. And so often, you can build extra private facilities, but if you don't have the doctors and nurses to staff them, that's where the problem lies, not necessarily the fact that it's private delivery of care, but that in fact we have a very serious health workforce crisis.
Mm-hmm. And underline the word crisis there, because you say that, and I think it's fair to say that Canadians really do take great pride in national health care. And I think about the debate in the United States over Obamacare, when Canada was held up as a model of what a single payer system could create and look like. But I'm wondering, is that pride now misplaced? Because here we have millions of Canadians not even having a primary care provider anymore.
Well, the shortage of access to family doctors or other primary care providers is an extremely serious issue. And to your question about whether or not Canadians' pride is misplaced, of course, we ought to be extremely proud of the fact that we do have universal coverage of health insurance for Canadians, and that they are by law allowed to have access to medically necessary care funded by that insurance, not funded by out-of-pocket payment. However, there are lots of things that don't fit into that system. There are lots of things like sometimes home care, mental health care, for example, for which there is not a publicly insured way to be able to get access to that care. And as you've mentioned, we have a big problem in the way that primary care has been designed across the country, and so that health workforce shortage requires a real realignment of primary care and a big emphasis on making sure that Canadians do have that access.
Oh, okay. Let's go into that a bit deeper then, because I do wonder what is needed to restore Canadian pride, faith for that matter, in the public health care system. What would it actually look like in future if the current, or at least the past model, is not what's working anymore?
Well, let me speak to what we think it could look like. And this is, again, something that we talk about in the report, where we advocate for the concept of every Canadian having access to a primary care health team. We believe that team-based care is a big part of the solution to the health workforce crisis, knowing that when people need access to care, it may not necessarily be a doctor they need to see. They may be able to see a nurse practitioner or a dietitian or a social worker to have their care needs met. But that just like we fund public schools for every Canadian child when they need to get access to school, every Canadian should be able to have access in their community, ideally within a half an hour's drive of home, to be able to go and see a primary care team. And we believe that that is doable.
Okay, doable. But, you noted yourself in the report, there have been recommendations in the past. It's been a stop and start kind of I guess, response to these requests and recommendations. What makes this time different? Here is this report. Obviously, the healthcare system right now is in crisis. But what makes this time different that makes you believe that politicians and leaders may actually be listening to what you're recommending?
Well, I think that the public is really been pushed beyond their point of patience. And so the report is called Taking Back Healthcare, and it speaks to the fact that this is the people's healthcare system or systems, and that people need to step up and demand and let their policymakers and decision makers at all orders of government be clear about what the expectations of Canadians are, that we have been proud in the past, but we're very much at risk. The system is in deeper crisis than it has been in our lifetimes, and it's time for people to step up and say, we expect you to get on with it, to rearrange our healthcare system so that we'll be able to get good value for the very large investments that Canadians make in having that healthcare system be there for them.
Now, we are expecting some kind of federal-provincial deal on healthcare next week. The provinces, as you know, asking for more money, the federal government asking for more accountability and data as well. What will you be looking for in that deal? What would signal to you an understanding of a way to address the crisis that we're in right now?
Well, you've spoken to some of the things that people are certainly expecting. We're expecting that the federal government is likely to make further investments in healthcare, that there are likely to be some kind of conditions attached to that. Certainly the data issue is one that the report speaks to, and there's a huge challenge around interoperability and access to data to support health systems and patient care. But I'm hoping that we're also going to see investments in the workforce. I'm part of Queen's University's Faculty of Health Sciences, where we train nurses and doctors, and we know that we need to be training more, and other universities like our own are prepared to be able to expand our programs, but that will require investment. And of course, a real restructuring of care so that people will get access, so those millions of Canadians who don't have a family doctor will be able to get the care they need. It has to happen now.
Dr. Jane Philpott, really appreciate the time. Thank you.
Thanks for having me.